And Dr. Spellberg, I mean, speaking a little optimistically to the fact that I think there is a good portion of the population that has, done this right and is, practicing, public health parameters in good faith and is kind of holding out for that outcome. And certainly what I hear from at least people close to me that, in discussing this with them is, there's this growing I just need for an end date, and obviously that's one thing that certainly can't be guaranteed right now. But they've invested their time and hopes and efforts into the sake of science catching up, right? And I guess the outcome that they're looking for is vaccines, which obviously aren't the perfect end to all of this, but certainly are going to be a big step forward once we feel we're in a good spot for these to be available, right? So I mean, is there anything else that you've been noticing in terms of, I guess, if we're at a spot where people are pretty much dug into how they're going to be treating this, and we're looking optimistically to the people that are committed to this agenda, is that the next endpoint that we're going to get them toward, or is there something else right now?
Yeah, I do think vaccines are the ultimate solution for us. I don't see another path forward aside from vaccines. But the same digging in on everything else will occur to vaccines. What percentage of the population is already saying they won't take a vaccine? No, I don't mean to imply that we can't get people undug. What I'm implying is, or what I'm saying is, to get people undug, we have to try a different approach than we've been trying. The more we push people who are resistant, the harder we push them, the more we yell at them, the more we nag our fingers at them, the more they're going to resist. That doesn't work. That's not how human nature works. It's like a Chinese finger trap. Sometimes you need to find alternate ways to reach people than doing the way we've been doing it now, especially when you have national leadership that's not in alignment with what the scientific community is saying. We have to find other ways to reach people.
Could those solutions be local if we're talking about matters in which, like you said, the whack-a-mole it's a regional issue. It's something that's popping up in places. Does that allude to the idea that when we get to a spot when we need to, get a greater vaccine adherence or interest at least in it to get closer to that immunity number that we need in the population, should that be coming from more trusted community-based advocates?
Trust is the key word. Yes, I do think there needs to be local maneuvers, local outreach, to the extent that you can buy and trust that way. But I also think there should be a massive PR campaign, right? Like there was around the polio vaccine. Different people respond to different messaging. Why don't we have Larry the Cable Guy doing, go get your vaccine or wear your mask? Get people who are trusted by segments of the population, reach out to them in really a serious, intensive campaign. Yeah. Put cameras in our ICUs, right? Show people what it looks like. This vision of, well, it's only old people who are dying and they're fine. They're going to die anyway. Put a camera in the ICU and show what it looks like to have a 35-year-old on a ventilator. Whether they live or die, that is a miserable existence. You don't want this. This is what we're seeing every day. We need to find ways to make people in the community who have not experienced the pain and suffering of this disease feel it emotionally.
And I think that kind of feeds into the fact that, something we've benefited from so greatly through all this is obviously the great rush of research and progression of understanding through all this continued research throughout this has benefited more and more, obviously, as we have more long-term data. But you haven't seen that really replicated on that messaging side. You haven't really seen
correct.
We have so many long haulers and we have so many patients still going through this. And you're right, patients my age, even younger, that are just extremely afflicted day in and day out. We haven't seen anything that represents that community of like, actually, this is how you should be thinking about this.
That's exactly the point. Yes, you said it very well. When we tell people, you need to wear a mask, you need to stay apart from people, you need to take the vaccine. Yeah. The people who are going to go, yeah, okay, I need to do that, were people that were going to do it anyway. Yeah. The people that were like, I'm not going to do that, they're not going to go do it because we did that. We have to find a way to reach them. Who are we talking to? Preaching to the choir isn't going to get the 40% of people that are recalcitrant on board. We need to find other ways to reach them, ways that they will respond to emotionally, if not based on objective science.